I rather have someone who is 38, healthy, normal BMI, eating healthy, versus someone who is 25, 26, morbidly obese, diabetic, hypertensive. Who do you think that is doing better? It's very important to know this. People think that, oh, okay, fine, I'll go and then take zinc and selenium forever. Okay, this is bad. Do not do that, okay? Because it can affect the sperm, actually.
Yeah, everything has to be within the body, within a range.
The balance.
Yeah, the balance.
By deep AI, we can detect parameters in the egg itself and the sperm as well. And based on them, we can classify the egg as low quality or high quality.
So we're now coming to the second part of the podcast, and we're going to be talking about the influence of your lifestyle and the way you eat on fertility, egg quality, and a baby's health. So what is your view on that?
To people who never disagree about that, this is very important and very essential to prepare your body into the optimum phase, whether for fertility or for pregnancy. I sat in a lot of discussions with nutritionists, and basically the more healthy you are, the better. Take it as that. I always say to my patient, I rather have someone who is 38, healthy, normal BMI, completely healthy, taking care of herself and eating healthy and all the good stuff, versus someone who is 25, 26, morbidly obese, diabetic, hypertensive. So who do you think that is doing better? Is that because she is younger is better? No, it's not. So obviously the lifestyle and health affect the quality of the egg and the quality of the embryos produced. Okay, we have seen it more and more, and we know now that age, it doesn't mean that it is doom and gloom. And so, because I have a lot of patients who comes, oh, I'm 36, I'm old. Please do not say that, because I don't like it. It's not anymore achievable. My last clinic I was working at, my clientele of patients were mainly from 40 to 50, basically. We shifted from this era of having IVF at 20s and 30s and whatever, to more and more, because of what we have said about the challenges in life and career and all this stuff. So being healthy, it will definitely help you. Now, whether eating, whether you have to be in the optimum weight, you keep your BMI at exactly the normal. If you see why the rationale of the NHS that do not fund people who are smokers, do not fund people who are not obese, overweight even, above 30. So the cutoff at the NHS is 30 BMI, 30 BMI. And this is to give us the background that being obese or overweight can affect negatively your pregnancy, i.e. miscarriage rate, preterm delivery, and complications during pregnancy, such as preeclampsia and IUGR or stuff like that. So this is a very important message. People think that, NHS is really hard on us, and why I'm only 31, BMI 31 or 32. But actually there is a rationale behind it. Because if you optimize your health, that means less miscarriage rate and less complication during pregnancy. And exactly the same situation about our logic of transferring only one embryo if you are 37 and below, because we are aiming for a singleton. So a lot of people comes as well. Can I have twins? And I'll be sorted. That's it. My family is completed. No, we say no, because we prefer singleton than twins. Twins is a double problem, is a double complication. So at one hand, you can say can I have a chance to have a twins? We as doctor, we say you can have a risk of twins. Do you get me?
Absolutely.
Yeah, so I always say, like, you will have a risk of twins if we transfer, not a chance to have like twins. No, because it's always, and that's why we pushing now, or been for a few years now, to single blastocyst transfer. So we are aiming, if we are getting into a very good quality blastocyst, means day 5 embryo, that's I'm going to transfer. I'm not going to transfer 2. Okay, despite even the age, sometimes if she is older and I'm allowed to put back 2, however, if I have a very good quality blastocyst, I would push towards 1 only.
Because of higher chances of a good result.
Of course. Any singleton pregnancy is considered a success. Twins is a byproduct of IVF, and we have to deal with it.
Understood.
But at the expense of complication that can be really sometimes disastrous.
Like premature birth?
Preterm birth is the main problem. And cerebral palsy and all this stuff.
Gosh, yeah.
So back to healthy. So if you cannot have your own healthy food, you can help with nutritionist advice. Also, the concept of male and female fertility supplements, okay? So a lot of people go to Boots or whatever and get like multivitamins. Is good, but now there are more and more sophisticated, evidence-based, say, male fertility supplements which address mainly the male sperm parameters with all coenzymes and in the ratio that it should be. So yes, we can have a generic one, but now there are more like a targeted male fertility supplements and also some female fertility supplements as well. And some people now are combining, like you can have like one for the man and one for that with the same brand. Yeah,
absolutely. I'm gonna explain a little bit about how I came with this fertility support part that I have on my platform. When I did my work on chronic inflammation, which is a dysregulation of the immune system, during that work, I got pregnant. But at that time, I was still very inflamed. And I remember I was around 8 weeks pregnant, and I started feeling like weird lower back pains. And I had a feeling I was miscarrying. So I went to hospital and I said, I think I'm having a miscarriage. They sent me for a scan and they said, no, look, the baby is very healthy, the heart is beating, and the fetus was really healthy. Mm-hmm. But I knew that I was so inflamed that the body was seeing this fetus as a foreign body, and that I was effectively expulsing it. And like how, you give steroids to people after IVF just to calm down the immune system, that it doesn't see the fetus as something foreign that it needs to expulse.
Absolutely. I mean, we achieve pregnancy by the body converts itself into immune recipient, like it's on the lowish kind of side of immune interaction, because the embryo is a foreign body, as if like to get implanted in the body. So the only way to be receptive is to lower this immune system. Otherwise, we'll have a rejection. And obviously, there are theories about miscarriage. Is one of them is immunological problems that can heighten the level of immune response. Hence, as if rejects the embryo.
Yeah, and that's exactly what happened. I actually miscarried that day when the fetus was totally healthy, because my CRP was through the roof, ESR through the roof, and all inflammatory markers were so high. So when I created my platform, I decided to really look into fertility and help other women not go through this. And I created this plan to help regulate the immune system, bring all the needed nutrients through supplements and foods, and also by looking into male fertility, it turns out that chronic inflammation does cause low sperm count and low, mobility in the sperm?
It's the scientific word for that is oxidative stress.
Yes.
So the oxidative stress obviously is part of it is from our lifestyle habits. Smoking is a killer for like the sperm cells. Apart from steroids and testosterone and bad food, junk food, and this, it basically causes oxidative stress. The higher the oxidative stress, the lower the sperm count and the motility and the normal forms. Apart from the semen analysis, now we can test for this oxidative stress. Okay, so there is a test that we do, and then we can assess the oxidative stress if it is high or low. Which brings me to a very, very important topic. Now, the concept is that if someone has oxidative stress or the parameters are not good, he goes like crazy on zinc and selenium, yes? Vitamins from Boots. He gets this for 6 months, a year, and then he said like everything should be okay. Actually not. Because we have proven that oxidative stress is bad, but also there is something called reductive stress. Have you heard about it?
No.
Okay, so the reductive stress, and that's why we now calculate what we call ORP. ORP is the oxidative reductive potential. Okay, and this is what we are saying is that too much oxidative stress is bad and too low is bad. Okay, so you have to maintain the balance.
Like cortisol.
Exactly. So we do not want this reductive potential to take over, because it's as bad as the oxidative potential. What we call stress, oxidative stress, is a reductive stress as well. So there is a balance, and that's why we say, okay, fine, we have a high oxidative stress by checking it, and we give antioxidants for 3 months at the beginning, and then we repeat this until we see a lowering of this oxidative stress. Then we say, okay, fine, you do not need more. Because the more I give, the lower it becomes, and then we go into the other phase, which is reductive potential, which is as bad as oxidative stress. So it's very important to know this. People think that, oh, okay, fine, I'll go and then take zinc and selenium forever. Okay, this is bad. This is bad. Do not do that, okay? Because it can harmfully affect the sperm, actually.
Yeah, everything has to be within the body, within a range.
The balance.
Yeah, the balance. Blood pressure, too high, not good. Too low, not good. Everything. Temperature, immune system response, cortisol, and oxidative stress.
Exactly.
Everything needs to be within a range.
It's a balance. Oxidative and reductive. So if you see like in any textbook or you look, it's a balance. So one is tipping up for oxidative, one is tipping down for reductive stress.
So you've spoken about how technology has completely transformed fertility and given us so much flexibility to do much more with our lives, really. We're now able to study and work and have a career and maybe have children later. Not to everyone, but it's more and more available to people within, when certain boxes are ticked, and hopefully you help them tick those boxes, and I help them with my work as well, tick those boxes. And now we're talking a lot about AI. Is this also interfering in a positive manner with fertility treatment?
I'm very happy that you mentioned this, because now I'm a co-founder of a clinic called Avenues, and what we do is mainly AI. AI is artificial intelligence assistance in IVF. We are the only clinic in the world that is offering AI solutions to help us to select the best eggs, the best sperm, the best embryos, in order to achieve at least an incremental increase in success in IVF. How does it work? It works by scoring system. So as you know, you look at the egg, you look at the sperm under the microscope, you think that, oh, fine, it's normal. By deep AI, we can detect parameters in the egg itself, like 5 parameters, and the sperm as well. And based on them, we can classify the egg as low quality or high quality. It's got a score between 1 and 9, and then we can say like, okay, fine, the one is scoring 8 or 9, has a higher chance of achieving a normal blastocyst. And we compared it to eggs which scored very low, 0.2, 1, 2, whatever, and they do not yield this kind of potential. There are now a huge impact from industry to produce what we call a sperm selection technique through AI. And there are already 3 available in the market. And you just put the sperm, it gets you on the screen, the sperm analysis, and instead of just your own eyes, it does it very intelligently with even getting the right sperm surrounded by green dots to tell you that this is the sperm you are looking for. And there are sperms surrounded by red dots which tell you, do not touch this sperm, leave it, and then use only this. These are technology emerging, and this is happening right now. And actually, we are doing in our IVF unit, we are comparing 3 of the modalities. One of is computerized assisted sperm analysis and other technologies based on AI, as well as the eggs, as well as the embryos. So at the end, what does it result? It results that, okay, it is helping me, it's not replacing me. And that's why when I give this talk, and I'm giving another talk in very, very soon in one of the biggest conferences, to say my last slide was that AI will not replace the doctor, but obviously if I am interviewing 2 doctors for the same post, I will take someone who is having a bit of knowledge about AI. That I will prefer him than someone who didn't have like this kind of knowledge. Why? Because this is the trend now, and this is what we are pushing. Because the more and more AI we are using, I cannot tell you how much the industry has improved in this kind of investment in technologies such as freezing, such as RI witnessing, egg quality, embryo quality, sperm quality, and combining all this together, it gives you at least a superimposed success rate on top of the other national average or average clinics, because we are helped by just simple technology that use softwares that combines all this scoring to give you the best score. So say from 1 to 9, it tells you, okay, fine, these are the embryos that you should replace because it scored 9. So you choose, and it gets you this in green color, so you cannot miss it. So you replace this one, it gets you 4 or 5, say you have like 12, 15 embryos, it gets you 5 with blue color, that means these are the best to freeze, and reds. The reds, you just discard them. So it's very easy. It cuts the administrative time to check. The embryologists are like really happy because it cuts their time of checking, because it's just a help. I still insist it doesn't replace, because people say, oh my God, the machine will replace like this. Where is the humans and the expertise and whatever? Yes, there is the expertise. But when it comes, for example, like to 2 greens, yes, so I'm still having the possibility to choose the best one through my eyes. You know what I mean? And a lot of other applications, such as mobile applications to the patient. She can see live her embryos developing day by day. So it's not like, a phone call from an embryologist after day 3. No, she is like following this day by day through her app, and this is amazing technology. And I don't know if you know that we have created a new society called AI IVF. And we had already 2 conferences in Croatia, and based on people who are interested in AI. And we had a huge kind of interest from people from all over the world, because it's not only embryology, it's wider than that. It's applications, softwares, it's helping patients to be more aware of what's happening day by day. She's not waiting for the phone call desperately to see what's happening.
You empower them with knowledge, with a sense of being much more involved, and bring the patient closer to the doctor, because they feel that they're working together at this.
Yes.
Versus the phone call, as you're describing. But the way you're talking about AI, it's like selection of the fittest sperm or embryo or egg. And
absolutely, that's what we do.
Yeah, so it's like technology and Darwinism.
Yes, in a way, yes, you're right.
Amazing.
Yes.
I mean, it's so wonderful because, we went from this world of our grandparents. I mean, my grandmother had children so young. My dad was born when his mom was 18.
Mm-hmm.
If by the age, my Iranian grandmother, by the age of 36, she had 7
kids.
Yeah. 7 kids.
Those were the days.
Back to back to back to back. And now women start thinking of a baby mid-30s. And our lives have completely transformed. And there's been this period of time where the expectations of a woman and their wants had moved, but the technology hadn't caught up. And by everything that you've said today, it gives me so much pleasure and hope for all these women who are going to be able to have it all, not at the same time, and not having to compromise incessantly over, between having children and a career. I certainly know that I have sacrificed my career in banking to have children. I'm happy to say it, because at that time I knew that that there was a time to have kids. And when I had my children, 2008, it wasn't as advanced as now. And I made the choice to, be at home with the babies and, just have a career later. And that's wonderful that now women can.
Of course, I mean, there are priorities, okay? So the priority is children, and what I'm really saying that do not leave it for too late. Okay, yeah, there are still options,
yeah.
But obviously I'm not pushing as well, like the sooner the better. I'm not telling everyone who started a career like to go and freeze her eggs like 25 and 26. Just be reasonable, and basically understand that our limitation still is age.
Yeah.
There is no way to beat this.
Yeah.
The quantity itself as well is a limitation, because we are declining the number. However, we are looking into technologies of how to increase these follicles, but there are some emerging maybe technologies. It's still not yet as if in clinical use, but the future is there. However, I'm afraid like at some point we are beaten by statistics. Like if someone comes like at 45, 46 and wanting a child with that, yes, but live birth rate is going to be like almost, zero, touching zero. But it doesn't mean that we cannot help. It will be exceptionally successful. If she has this, it would be an exception. But it means that please do not leave it for too late. And seek advice. I mean, fertility MOT is one of the best things that you can do, and we at least if you have a baseline, at least we know where we are. To the men, I said, do not be, very kind of you should be more cooperative in a way that to say that yes, it's one of these tests that should be done. I've seen a lot of really very bad managements, like treating patients with ovulation induction for 6 months, for a year, whatever, and then to have like the surprise at the end. So it's not good. This is not good medicine. So at least if we have all this together, then we can just proceed forward.
So on the male fertility thing, I think there will be a change, because I have 2 teenage boys. They're 14 and 16. And I'm going to talk about something completely different, but it's going to just, you will see the link. I remember buying their father moisturizer, and he looked at me as if I was a mad woman. He had the dry skin when I met him, and I was like, I can't deal with this. I need to dip you in oil. So I got him this argan oil from Morocco, these moisturizers and these scrubs to try and improve his skin. My children are 14 and 16. When they run out of the good cleanser for acne and of the right moisturizer, they call me and say, Mom, can you please order more? I've run out for my skincare routine.
Yeah.
And they're big boy playing rugby. They have no problem about, how masculine they feel. For them, it's got nothing to do with,
it's nothing to be ashamed of, really.
Absolutely. So I think that for their generation, just like women now will go and do an AMH test to check their fertility, I'm pretty sure my kids will be completely comfortable in 5 years getting their sperm count and do a semen test. So I think this is going to change. It's just
some
a matter
people
of
come
time.
like as a male fertility MOT. Just, he comes and they say, I want to check myself. So that's really something really nice to do, because he might think to freeze his sperms as well.
Yeah.
Rather than being... So there is egg freezing, but don't forget there is also sperm freezing.
I'm so happy you're talking about this. That was my next point.
Yeah.
So we have all heard that as women age, the egg quality decreases, more chances of, an sub-performant embryo and abnormalities. But it's the same with aging sperm, except no one talks about it. So if you could just touch
aging
a couple of...
sperm is happening, definitely. We cannot beat nature. We cannot beat age. And especially with all what we are experiencing as stress at work and jobs as well. Jobs can as well deteriorate sperm parameter. People who work in dyeing industries, like using dyes and stuff like that. People who are like truck drivers, for example, like they go inter countries or inter whatever, like sitting on the wheel for like big 12 hours. People who are like putting laptop on their laps like all the time. So it's laptop, but do not use it as if exactly what it means. Okay, so you can use laptop, but because basically we are moving towards less damage to your sperm count. Smoking, definitely not drugs and stuff like that. But the most important thing is the male fertility supplements help, the lifestyle helps, and freezing sperm is an option if you are not considering, for example, like one more thing is about the age now and the time to conserve sperm and freeze the sperms. It is open up to 55 years. Up to 55 years of land, not up to 55 years of age. And the egg freezing, which was only for 10 years. Now it is again like extended to 55 years as well. Yeah.
So I'm just going to try and create a quick summary. If you are thinking of maybe one day having children, start by doing your fertility check, whether you're male or female. Maybe consider if it's applicable to you to freeze sperm or eggs by talking to your doctor, and adopt an anti-inflammatory lifestyle to improve your gut health and immunity, which is going to be amazing for conception, but also for the baby, because when babies are born, they inherit a mother's microbiome, and the stronger your gut flora, the more diverse your microbiome, the better it is for your baby to come and its own immunity.
There is a huge input now from microbiome, and in international conferences they are talking about vaginal microbiome and how we should improve this to increase the lactobacillus presence in this media. So all we are talking about is intestinal, vaginal microbiomes, and you have also this products that you can purchase that can help to restore the lactobacillus, which is the main good kind of microbiome that you have. So take advantage of this because it is there. You can use it, and it does improve the health, as you were saying.
Absolutely. So you can improve, your gut health through many things. Indeed, supplements, and there are so many different strains of lactobacillus. Bifidobacterium is also very present in the gut. Those are the two biggest strains. And what's interesting? Many people don't know this, but there are different strains that have been proven to help different things. Mm-hmm. So some strains will increase a little bit inflammation for immune system, like if you want to increase your immune system. Others will lower it. Some will help with female health, like reduce the chances of cystitis. Others will help have more. So different strains can apply to different things. But the most important thing is when you take a supplement, it has to be really well calibrated. The bacteria still has to be alive. It depends how it's been kept. Was it in the right conditions? But every food you put in your mouth has an effect. It's never neutral. And it either is going to feed the good guys in your gut or it's going to feed the bad guys in your gut. It's never zero. And people sometimes think that with a pill, and I'm all for, the right supplement in the right application, but sometimes people think that with a pill they can offset every other thing they put in their mouths, and it doesn't work like that. Mm-hmm. So every different vegetable will have prebiotics to feed the probiotic in the gut. Different kind of proteins will help build the gut lining and help the bacteria thrive. So all of this works together. So review the food you eat, the supplements you take, and take it as a whole and have a holistic view for optimal health and optimal fertility.
Absolutely.
Thank you so much for joining us today. It's been such a pleasure.
I'm delighted.
I've learned a lot about all the technology around fertility. It's been really wonderful to have you today.
Thank you.
Thank you so much.
And I really have the pleasure to have met you today and responded to the queries. I'll be looking forward for more, and best wishes for everyone trying. Thank you so much.
Thank you. And I will be linking all of Dr. Wakim's details, his website, contact, all of that in the description box. So if you want to go to his clinic and have a little fertility check, you can go and do it. Thank you so much.
Thank you. Thank you. Have a lovely day.
Thank you so much to all of you for listening to this podcast today. I hope you enjoyed it. It's always such a pleasure to talk about health because it's not about the destination, it's about the journey. Looking after our health is a daily thing, just like brushing our teeth. We've got to focus on it, we've got to do it right so we can live better and happier lives. For those of you who are not members of the platform yet, we have a discount code for all our podcast listeners. You can get 15% off the memberships. Just enter the code podcast15 at checkout. And make sure to read all the articles and all the free content we have on eatburnsleep.com to keep you motivated and informed and educated about living an anti-inflammatory lifestyle.